want to welcome everybody. And we have a speaker from Nazareth, Brittany Williams, so she'll be giving out a talk this time. So what I do is do a little housekeeping. So some reminders. So Tuesday, June 13th, 5:30 to 7:30 p.m. at Casa Larga Vineyards, 2287 Turk Hill Road. The Rochester Michael J. Fox educational event. So our group, Parkinson Support Group of the Finger Lakes, will have a resource table, and some of us will be there with information. So please stop by Casa Larga, try their wine or not.
You have to register, don't you?
Yeah,
we register.
We're waiting. I thought we had to register.
Robin from Safe at Home Physical Therapy, she sent the link to me, and you do need to register for it ahead of time, but it includes beer and wine and snacks. So I would register so that you can get some food. No, it's free to register as far as I know.
Okay, another event coming up. Saturday, June 24th from 11 to 12:30 p.m. And this is Nazareth College in partnership with Rochester Parkinson Network. They present physical therapy, speech, and swallowing. So that's a good one, 11 to 12:30 Saturday, June 24th, and that's at Nazareth College, East Avenue in Pittsburgh, Rochester. So I did put some flyers back there. I'll get it out. Just as a reminder, our group, Parkinson Support Group, Parkinson Single, Parkinson Support Group at thefingerlakes.com. Website, all this information is going to be on the website. So go through there. We also have brand new, I think it's only been up and running 2 months maybe. We have a bulletin board if you need or you have things, items, medical items that you don't need anymore, wheelchairs, beds, canes, whatever related to Parkinson's. We have it for whoever the contact person is will say. It's either for sale, for loan, they might want it back, or give away. Okay, or give away. So that's updated. I update that whenever we have something going off. The lift chairs go on, they're gone. People watch this, and they're gone within less than a day. There are none right now for lift chairs. But there's a couple beds.
Look every day if that's what you're after.
Yeah, yeah. Okay, Wednesday, June 14th, 1 o'clock, by Zoom. This is People with Parkinson's Support Group. That's by Zoom. Make sure we have your email, the new people. I have your forms. We'll get those loaded right up. So that's Wednesday, June 14th, 1 o'clock. It's an hour support group. That's headed by our moderator, Dr. Stu Gillen, who's on vacation. It's me today. Wednesday, June 21st at 2 o'clock by Zoom is the caregiver support group for the caregivers. So I chair that, so we have a good hour and we share a lot of information. So anyway, without further ado, this is Brittany Williams from Nazareth.
Hello, everyone. Thanks for having me.
Hi, Brittany.
So a little bit about myself before we dive in. I am a speech pathologist. I graduated from Nazareth back in 2015. I spent about 5 years working for Lifetime Care Home Care. I don't know if any of you are familiar with that. I still say we because I worked there for a long time. They've since been bought out by Rochester Regional Home Care. When the pandemic hit, I, for some reason, decided travel therapy sounded like a good idea, I think because it was the only way that I could travel during the pandemic. So I spent some time out in Lake Placid doing speech therapy in the Adirondacks, and then I went out to South Central Oregon, where I did home care there. And that part of the country is so much like where I grew up in Steuben County. It's farms, tiny towns, and no hospitals within at least an hour. So we would finish doing home care. Has anyone ever had home health care before? So in order to get home care, you're familiar, you have to be considered homebound. But then once physical therapy and nursing and all of them say, yeah, you're good to go, you're not homebound anymore, oftentimes people who still have speech therapy needs, they have to then go to outpatient. We can't continue seeing them in the home. And so that kind of got my wheels turning when I was in Oregon and reminded me of home and how there are no outpatient clinics where I'm from. I grew up in Avoca, Cuba Lake area, and people get sent to Rochester or to Sayre, Pennsylvania. So then I decided to move home and start my own practice. If you picked up a flyer or a brochure in the back, BPAC Speech and Swallowing is my practice. I'm covering mostly the southern Finger Lakes area, mostly Ontario, Yates, and Steuben County at this point, but I also do offer telehealth, so I can branch out a little further if necessary. And I do in-home therapy because I loved home care, because we could really personalize things within someone's home rather than being in a more sterile hospital clinic setting. That's just kind of the basics about my practice. Has anyone worked with speech therapy before? Are you familiar with what we do other than just speech? So we do work on speech and voice, as well as word finding and language concerns, cognition, memory, and also swallowing, which is the focus of what I'm going to talk about today and how that relates to Parkinson's. But certainly if anyone has any questions about speech and voice, I think that you guys have had speakers before to talk about speak out and voice therapy. But I am certified in that as well. So if anyone has any specific questions at the end, I'd be happy to talk with you about that. But for now, we're just going to talk about swallowing and how it relates to Parkinson's. So first of all, have you ever heard of the word dysphagia? Has that been thrown around at all? Does anyone have difficulty swallowing? Has anyone started to notice those symptoms? Okay. So there's 3 phases in the normal swallow, and it's a very automatic process. When they talked about speak out before, does everyone remember kind of the conversation about intentional speech versus how speaking is automatic? Does that ring a bell a little bit? I don't want to keep repeating things that you've already heard, but certain things that we do are automatic. Walking, talking, swallowing, all of those things. Yes. The way that Parkinson's impacts the brain is it reduces the amount of dopamine, which is the chemical responsible for those automatic processes. So those automatic things become more difficult. You may notice that your voice is a little quieter or a little less clear. Swallowing may become more difficult. Your gait may change. You may take smaller steps and shuffle a little bit. So swallowing is mostly automatic. There's 3 phases though. There's the oral and oral prep phase, which is the process of actually getting food to your mouth, and then chewing and manipulating it, getting it ready to swallow. That bit, not so automatic. We actually think about doing that. We're aware of what we're doing while the food is in our mouth. As it moves back, the pharyngeal swallow, this part in your throat, is reflexive. So we don't control that. We get the bolus or the food back to a certain point, and our swallow reflex kicks in, starts the motion of things moving down. And then the esophageal phase is, there's the 2 airway, or the 2 passageways in there. You have your airway, your trachea, and then your esophagus that goes to your stomach. That bit we don't have any control over. It just squeezes the food down to the stomach. So those are the 3 main phases. We're going to focus mostly on the first 2 today. There we go. I'm hoping this video works. So this is just a little video about how the normal swallow works. You can see we're chewing, manipulating the food, your tongue is moving, your jaw is moving, and we move it back. Point where the reflexive swallow kicks in. Really groovy swallowing music too. And you'll see that a bunch of muscles kind of move together to cover your airway, and then it pushes it down the esophagus. So there's a lot of muscles coordinating without us even realizing it. Super automatic. But again, the reminder is that if you have reduced dopamine, those automatic processes don't work quite as well. So I mentioned this before, we have 2 pipes, 2 pathways in your throat. You have your esophagus, which goes to the stomach, and then the trachea, which goes to your lungs. There's a little diagram here. Has anyone heard of aspiration? Aspiration pneumonia? So what that is any food or liquid that goes kind of down the wrong pipe. If it gets below the level of your vocal cords and into your lungs, that's aspiration, which can lead to pneumonia. So wanting to prevent that is important. So like I said, remember Parkinson's affects automatic processes. Changes in speaking, chewing, swallowing are common and can interfere with important parts of your life, like eating well. For me, speaking and eating are the highlights of every single day. I don't know about you guys, but that's a big part of our social life. It's also how we thrive as humans. We communicate with one another, we share meals with one another. The problem is that difficulty with these things don't always have obvious signs. So many people with Parkinson's aren't aware of those difficulties. The handouts that I have back there, if everyone was able to grab one, there's a list of those on there for you to keep for your reference, and we'll go over them a little bit. So like this says, things that you might notice are slowness of movement, can impact biting, chewing, using your tongue to effectively move food around, and also your tongue actually pulls the food back to prepare for that automatic swallow. So these are some signs to look for. You'll also see them on that handout. Unintentional weight loss is a really subtle one that people don't notice as much. People avoiding drinking liquids because it's uncomfortable or makes them cough. The sensation of food sticking in your throat. Does anyone feel that one? Kind of get that lump feeling. Okay, specifically with medications. Drooling, that's a really common one. People with Parkinson's tend to have less control of their saliva or even excess saliva production. Food collecting in and around the gums, kind of sticking in the mouth. Coughing or choking during or after eating, that's the big one. Those are when you swallow and you feel something go down the wrong pipe. We've all done that once in a while, right? You start coughing. Throat clearing is another more subtle version of that. Also, heartburn or sore throat are signs of difficulty swallowing, and trouble keeping control of the food or liquid in your mouth. Some people have it, actually, if they have any facial or lip weakness, they may feel it kind of spill out a little bit. So dysphagia, it's just a fancy word for difficulty swallowing. But it can lead to pretty serious things. Malnutrition, dehydration, and like I said, aspiration is the big one. As I mentioned before, aspiration is food going down the wrong pipe or entering the airway, and aspiration pneumonia is the leading cause of death with Parkinson's. So it's a big deal. We want to stay on top of swallowing as early and often as possible to prevent hospitalization, to prevent any respiratory complications. So the major signs, as I mentioned, are coughing, throat clearing, or if your voice ever sounds wet or gurgly after you've swallowed. Has anyone noticed that before? You just sound kind of like you got some water or liquid hanging out in your throat. Those are the major signs. But aspiration isn't always accompanied by these signs. There's also what's called silent aspiration, where if someone has reduced sensation, they may not realize there's food or liquid hanging out near their airway, and they may not have that airway protection or a cough to clear it out. So we're going to look at another video. You'll see the normal swallow first, and then on the left over there, or your right, I guess, is the abnormal swallow, so you can see the difference between the two. So on the other video, you'll see that it kind of pools and then doesn't enter just the esophagus. Do you see how it kind of splits and enters the airway? So that's what we're trying to prevent. And when you cough, that's actually your body's way of trying to expel that back out of the airway. That's a protective mechanism that's built right in. The good news is dysphagia is treatable. People with Parkinson's tend to respond really well to exercise. To go kind of back to the speak out thing, the voice exercise, a lot of people think that Parkinson's causes weakness. Does anyone kind of have that perception? Do you feel like you've gotten weaker with Parkinson's? But the reality is with that reduced dopamine, what's happening is your muscles aren't weaker, you're just not using them to their full amplitude. You're not using them to their full strength. Not using your muscles to their full strength is what eventually weakens them. So if you sit on the couch all day, your legs get weaker. By not using your muscles to their full potential, they start to weaken over time. That's why people with Parkinson's respond so well to exercise and therapy. So what a speech pathologist does is we will complete a clinical swallow evaluation where we may do some assessment of your muscles and your nerves as well and watch you eat and drink a few different things. We also may refer you out to a clinic or a hospital to do what's called an objective swallow evaluation, where they'll do a video x-ray, which is what that video was I just showed you, to actually see what's happening. Unfortunately, they haven't invented x-ray glasses yet, so we can't see everything at bedside or at tableside when we're doing these. But then, depending on what the nature of your dysphagia is, again, it could be more oral, or it could be more in your throat or pharyngeal. We'll do a number of different things. We may develop an exercise program targeted to strengthen the specific muscles that you need to strengthen. We may teach you some compensatory strategies to protect your airway and make things a little easier. We sometimes recommend diet modifications, choosing softer, more moist foods. For more severe dysphagia, we may even recommend thickening liquids, though I try to avoid that at all costs because no one likes to drink thickened liquids. Or we may do a combination of all of the above, depending on what your needs are. And again, that's why I like to do home-based therapy, because we can actually assess the foods and liquids that you're drinking in your house every day, rather than in a hospital where we may have graham crackers and a fig Newton and apple juice, and that's all. We can do a longer assessment too and see if it's changing throughout the duration of your meal. Are you fatiguing? Does it get worse towards the end? Is it something that's more esophageal in nature, where towards the end of the meal you start to feel that buildup, but you didn't have that at the beginning of the meal? You can kind of problem solve and see what strategies and exercises will work best. More than 80% of people with Parkinson's do develop dysphagia during the course of their disease. Like I said before, it can reduce quality of life. It complicates swallowing your medications, and anyone who's taking their medication regimen routinely, that's a big part of managing your Parkinson's. Like I mentioned before, can lead to malnutrition or aspiration pneumonia. So these are things we really want to stay on top of. So in conclusion, stay in tune with yourself or check in with your loved one with Parkinson's. It is a progressive disease, and swallowing abilities can change over time. Just because things are going well now doesn't mean that in a month from now they may not change. It's also variable day to day. Early intervention and frequent follow-up are really important, again, in preventing any respiratory illness or hospitalization. Often the signs are subtle, so really be in tune to those signs and symptoms. It's hard to do because eating is so automatic. We don't think about it. We all cough once in a while. You may not really be in tune with, geez, this wasn't what was happening 5 years ago. But because you do it 3 times, more times a day, every day, it's kind of hard to pay attention to. But if you think you have difficulty swallowing, that's my plug to myself. You can ask for any speech therapist, but I want you to call me. Speech therapy, like physical therapy, is direct access. You actually don't need to call your doctor first. You can call a therapist, we can get started, and then contact your doctor for orders. So if you just have questions, feel free to reach out to the therapist in your area. Just say, these are the things I'm noticing. Do you think therapy would be beneficial? And we can kind of counsel you through that and make a plan together. Does anyone have any questions or things they want to share about swallowing changes? Yes.
You and I talked just before the meeting started, the size of the meal can make a difference in how you approach how you eat it. The more food on your plate, the more you think you need to take larger bites, or when actually what you need to do is spread out that meal.
Yep. Sometimes we'll recommend doing 4 or 5 small portion meals throughout the day, especially if it's something that's more of an esophageal problem than it is a swallowing muscle problem. So doing smaller portions more frequently is a strategy that sometimes is effective. Depending on the texture, the viscosity of the food too, taking a drink between every bite can sometimes help you manage that a little more easily. I don't tend to do that. I tend to wait and drink at the end of my meals. Just, I don't know, probably because when I was a kid I was slapped for drinking all my juice first, but trying to be in tune with that too. Notice what you're feeling throughout the duration of the meal and if it changes over time. Anyone else had any symptoms? Yeah.
We felt that drinking seltzer along with the meal helps.
Okay, interesting. Sometimes there's not a lot of hard evidence about it, but I have heard in the last 10 years of practicing that carbonated beverages can just kind of wake up and improve the sensation for when you're swallowing. So that may be what's happening, is that your nerves are just more aware of what's going on while you're eating and drinking. Yeah?
long time ago, I had unintentional weight loss, and I dropped about 80 pounds, you know,
Oh, wow.
but it turned out to be diabetes,
Uh-huh.
and I was drinking more water, so
Yeah.
this is avoiding the drinking liquids. And of course, if you're drinking carbonated beverages when you go to the dentist, they're going to let you all the way through your cleaning. You shouldn't be doing it.
Yeah, that's the problem, is when all of us professionals are giving you different advice, right?
Right, exactly.
Anyone else have any thoughts or questions? Yes?
I've heard of a therapy which included stretching the esophagus.
Mm-hmm.
When and how and why not, or what regarding that?
So some people do develop what's called a stricture, or they may have dysmotility. Like I said, the esophagus is more of an automatic. It's a smooth muscle. We can't control it the way we can our tongue. So once the food hits that, we don't have control over it. So some people, it kind of stiffens and can even narrow. So for those people, swallowing therapy, what we do, doesn't exactly help. We can do some things to relax the top of the esophagus, but if it's a stricture, an actual physical narrowing, GI can go in and put in a little balloon to stretch it, and that can be super beneficial. I know people who've had it done once and they're good to go. I know other people who have to go in and have it done every 6 months because it kind of constricts right back. So depending on the person, that is certainly a strategy that has been helpful for a lot of folks, with or without Parkinson's. That's a pretty common one with age.
Thank you.
Yeah.
What do you do when you have all the food around your gums? Oh, I hate that.
Do you have dry mouth?
Yes.
That could be part of it. So taking, like I mentioned earlier, alternating drinks throughout your meal, taking sips between bites just to keep things moist. And also trying to use your tongue to scoop it around. As long as you've still got good range of motion for your tongue, you should be able to reach all those little crevices and pull things out. But what you're describing sounds more like probably due to dryness, that things are kind of getting stuck in there.
I've got Sojin syndrome.
I'm sorry?
I've got Sojin syndrome.
Okay. Does anyone else have either dry mouth or excessive saliva?
Yeah,
It seems to
dry
be-
mouth, I'm thinking it's along the lines of some of the drugs, you know.
Yes.
One of the side effects of some of the
Yeah, a lot of medications, dry mouth is a big side effect for.
I found a spray bottle from, there's several companies that have it. I keep it right by my bedside.
Yeah, Biotine's a pretty common one.
Biotine,
They have the
CVS
spray.
has their own brand.
Yep, they can suck on lozenges too that can help moisten. The problem with that is it's a fix in the moment and then it kind of goes
Yeah.
right back. But staying really hydrated can try to counteract that. I mean, if it's medication induced, probably not going to be 100% better just by drinking plenty of fluids. But keeping hydrated and drinking as much as possible can help with all of that oral moisture. I saw a few other hands over here. Yes? Either one of you. Go ahead.
Yeah, I have problems drooling a lot. Not sure what
So drooling is a tricky one because a lot of times, like I said before, on the opposite side of dry mouth, there can be excessive saliva production. And because swallowing is automatic, that reduction in automatic processes, people with Parkinson's don't tend to manage that excessive saliva as well. You're not swallowing automatically as often as you would have before. So trying to be aware of when you're feeling that saliva buildup and then consciously swallowing can help with that. Or having a rag handy, for sure. Yes,
This is a question about a very, very, very tiny pill.
okay.
And the technique I have used to swallow this is to put it on my mouth and to take a fair amount of water to kind of surround it and drown it as I take it out. Doesn't always work, so it's hanging around in here.
Okay, but just the tiny ones, not anything bigger?
No, this is the smallest pill I've ever seen.
Huh,
And I had swallow tested. They thought I was concerned about swallowing something big,
Right.
so they gave me something big, and that's not a problem.
right. I wonder if a little bit of that could be, and I don't know, because again, I don't have x-ray vision, the teeny tiny ones, you may not have sensation enough to feel it, to clear it out and swallow it. Sometimes the smaller stuff gets kind of stuck and we're not quite as aware of where it is, whereas if it's a large pill, you can feel exactly where it gets lodged and then you can kind of push it down.
Yeah.
Have you tried it in a bite of like yogurt or something like
I
that?
think that's probably a good idea.
Yeah, that will just make it a little heavier and also slippery, so it might go down a little easier. Yeah.
Yeah, the problem is not being able to feel when they're not going down at all. As opposed to the large probe where you think it didn't go down.
Right. Yeah. Yes.
Taking a lot of medications, the powdered tablets are hard to swallow because they're dry. So sometimes they're available with coatings on them, like gel coating and stuff. So sometimes you can switch to a different coating, or else they
Yeah.
say take yogurt or something to help
Yep.
lubricate it, because the powder ones seem to get stuck more than the
You know.
coating.
The dry, chalky ones tend to be more problematic than the capsules. And always ask your doctor. There's so many different versions of most medications, not all of them, but a lot of them they can probably give you a different form if necessary. So always check in with your doctor
And
about
a
that.
lot are available as liquids.
Yes, and a lot are available as liquids too, we just said. You sound like you know about medications. Yeah, he told me earlier. Any other questions? Yes?
I think I've had Parkinson's for years before I was diagnosed. And one of the problems I had was, I went to an ENT. He said my vocal cords, I had to give up oral singing.
Okay. And they bowed a little bit?
His official diagnosis was flabby.
That's a nice way to put it.
It's very uncomplimentary.
He said they weren't coming together.
Yep.
Would that have been related to Parkinson's, or was that something else?
Yes, we are.
It probably was. A lot of times people do have a little bit of bowing of the vocal cords, and so then when they vibrate, I'm trying to simulate this with my hands, our vocal cords kind of do this and this at the same time. So if they're bowed a little bit and they're not fully approximating, that's where you get that breathy vocal quality. You may have reduced volume, you may have a little bit of hoarseness. So that's likely that it could have been related to Parkinson's.
And we're constantly losing dopamine. We've been losing dopamine for 20 or 40 years even before our diagnosis.
Yep. And that's why a lot of people, you mentioned that you think you probably had Parkinson's sooner than it was diagnosed. That's such a common thing that I hear people say. And I actually met with a neurologist at another support group recently who, I forget what the percentage was, but the amount of dopamine that you lose before you start noticing physical symptoms is way larger than you would think. So chances are that most people have it far before they're diagnosed, far before they're noticing symptoms.
You have time for a few speech questions?
Absolutely, I was just going to open it up if anyone has questions about speech or voice.
So, I'm relatively new to all this, but it seems when I speak, I can hear myself perfectly well. And it feels like I'm even talking loud, but the receiver isn't perceiving it.
That's me.
If I had a nickel for every time someone said, I talk fine, my spouse just can't hear me.
So what's the issue there? I mean, what's happening? It makes that seem like you're yelling.
Yes.
And yet,
Yes.
that's coming.
So the perception of your own voice can get a little bit skewed. Remember, we were talking about the automatic processes. In fact, let me pull up. I have another little PowerPoint. I think I have a few visuals on it. I think this is the right one. What's generally happening is it's requiring you more energy to achieve the same level of volume than it used to. So normal volume is here, and you used to have to use this much energy to reach it. When your dopamine is reduced, you have to kind of overshoot. It's taking more energy for you to reach the same level of volume. So it feels like you're yelling. It feels like you're using way more energy because you are, but your volume is still here. Does that kind of make sense?
So what you hear is it not louder or it is louder? What you're hearing?
What everyone else is hearing is a lower volume than what you're perceiving, because it's taking you even more energy than it used to reach that normal, typical volume.
The thing is that I can't hear him because he talks down instead of having his head and straight forward. I keep saying, look at me and talk.
Yep.
So that's 3 up.
That can certainly be part of it, is the direction that you're projecting your voice, and that's a great strategy to kind of compensate for that reduced volume. What speech therapy can do, specifically the Speak Out program. Let's see if there it is. I think there's a video on here of before and after. We essentially, similar with swallowing, we talk a lot about intentional action versus automatic. All those automatic processes are affected by dopamine. When you do them more consciously, when you're thinking about how you're doing it and doing it with purpose, you're not relying on that dopamine system anymore, so the muscles are able to use their full potential. Oh. This is a lot of the... Okay, here we go. Some of you may have seen this before.
Jacqueline Ann Sprower. Jacqueline Ann Sprower. I can lose my voice, yeah. What else have you noticed? As far as voice is concerned?
Yes.
Nothing really, unless my husband or something. Has anyone said anything to you about your voice? Well, sometimes my daughter will say clear your throat, or my husband will say clear your throat.
I'm gonna pause it. What do you notice with her voice? What are you hearing? Scratchy, kind of gravelly, right? Reduced volume. And then when she...
And she fades out.
When the sunlight strikes raindrops in the air, they act like a prism and form a rainbow. The rainbow is a division of white light into many beautiful colors.
You could see her shouting.
Well, she wasn't shouting though. She was projecting with purpose. She was emphasizing everything. And as soon as you do things more purposefully, think about if you're sitting in a group like this or standing up talking, you're actively projecting your voice a little bit so that you're reaching every corner of the room. That's what we work on in therapy, is using that mindset and being intentional about speech and also swallowing, to be honest, so that you're not relying on that dopamine system. Did I answer your question? I'm not sure that I did.
Yeah. I'm working on it.
So,
We'll talk about it.
yeah, we can talk about it more when we branch off if you'd like. Does anyone else have any other questions, speech-wise or swallowing-wise? Yes?
Is there a relationship between cognition and speech?
Yes. As far as speech therapy or speech in general? What do you mean? Because both,
As you lose your speech quality, does it affect cognition?
I wouldn't say that losing your speech quality directly causes any changes to cognition, but cognitive changes are very prevalent in people with Parkinson's, yes.
Yeah.
Yep. Does anyone notice cognitive changes?
Having difficulty finding the right word.
Word finding? Yep, that's a pretty common one. Memory. Yep. So that's, again, another area that speech therapy can address and work on. It's part of the reason I love the Speak Out program for voice, is that every day's lesson, every exercise includes a cognitive exercise to kind of work on those indirectly. But certainly speech therapy can work on trying to strengthen and work up strategies to compensate for memory or word finding, as well as kind of adapting your things you do day to day so that you're able to compensate for any changes to memory or word finding. Or attention, that's another big one. People start to notice they're a little more distractible or not as able to focus or shift between task to task. So those are certainly things that come up.
I've had problems that's been going on for a few years, and been to several specialists. But what happens with me is I talk louder and trying to sing hymn or something like that. The serial plug up, like it went underwater.
Interesting.
This one will plug up.
Yeah.
And then it's like the sound starts reverberating in my head, and I'm getting a headache. So
Interesting.
I went to.
You seen an ENT about that?
Yeah, I've got allergies on the ENT, but I told them, they checked me all over, so you can't find anything. I said, well, one other thing I noticed is that if I touch it in my ear like that, it starts to affect my gag reflex.
Huh,
So they're saying, oh, it looks like these patients do, they take the x-rays and all sorts of stuff. There's nothing wrong with it.
huh,
So I'm saying, well, it's one
interesting,
of the reasons I think I talk about it, because now it's blowing up.
okay,
Yeah,
interesting.
it's hard to, it's almost like when you're driving up the hill or.
Yeah, let me ask you this, when they did your assessment at the ENT, did they have you do any singing during it while they were looking?
No,
Or were they just looking?
they were just looking. The first one I went to, they did some more testing. It was kind of weird too, because he went into this year and he puffed it with air. The feeling went away for about 5 seconds, and it
Okay.
came right back again.
Interesting. Yeah, it sounds almost like you're getting a pressure change, like your Eustachian tubes
Right,
or,
exactly.
but I would almost want them to do, and I'm not an ENT, so
Right,
don't
right.
take, this is not medical advice, but I'd be interested if they looked and did the assessment while you were speaking loudly or singing, if they could see a change from when you're just at rest.
I don't think they did that at all.
I would push for that the next time you're there, if it's really that bothersome to you.
Yeah.
Yeah, so it's specific to those contacts. Interesting. Yes.
How does the smell thing relate into food or swallowing or tasting or anything?
Say more about the smell thing. What do you mean?
Well, not being able to smell foods or flavor or senses.
Yeah, so when we think of taste, we're actually thinking of flavor, which we mostly get from smell. This became very apparent to me back in 2020 when I got COVID for the first time early on, and I lost my sense of taste and smell for like 3 weeks. I could still tell when I ate something if something was sweet or salty or bitter. You get those taste senses, but the flavor, like you could tell something is sweet, but you can't tell that it's chocolate. That is because of a loss of smell. So they are very intertwined. Have you noticed a lessening of appetite or anything because of that?
Taste. Lots of taste, I think.
But has it reduced your appetite because of that lack of flavor?
No.
That's good, because it's when I had COVID, I didn't want to eat anything, it was boring.
Still trying to lose weight.
As long as it's intentional, not unintentional weight loss, we're okay.
No, just that, it was lilac season, so she put a big bouquet of lilacs on the table, and I thought they were plastic because I couldn't smell them. And they're sitting right in front of my
Yeah.
nose. Normally, it lights up the whole room. But it's mostly with food. I mean, you say you can't distinguish like French fries from potatoes from something.
Yeah, yeah, and that's a lot because of, like I said, most of our flavor perception is actually from the nose, not the tongue. We don't realize that because you think of your sense of taste as your tongue, but a lot of it is from your nose. Yes.
I was gonna ask that, have you had COVID?
So yes,
Could it be a COVID?
yeah, it's probably got some hangover from the COVID.
There's certain things that I still can't smell, but most of it's back. But once in a while, I'm like, oh, that used to be a very strong smell that I would have recognized. So I don't know for sure what could cause that. It could be long COVID, it could be anything.
Well, with COVID, I lost the taste and the smell. Both.
Yep. That's the thing too, is we're talking about Parkinson's, but there's so many different things that can impact each other. That's the other reason that I love doing home-based therapy is a lot of times in clinic settings, we're very focused on, okay, these are your deficits, we're gonna try to fix them, versus looking at your whole life. And for some people, not being able to remember what day it is does not matter to them. They're retired, they don't care. So why would we work on that as a goal in therapy? We can really hone in on what your goals are and what's impacting your day-to-day life without worrying about trying to meet the standards of an overarching system. So that's kind of my stick on home-based or small therapy clinics, is that we try to look at you as a whole person, not just, I'm only going to look at your speech. I'm going to look at how everything's impacting your communication and your quality of life. Because Parkinson's affects everything, right?
Plus, getting a look at the whole environment is essential to some therapies.
Yes, especially I love my physical and occupational therapist colleagues that do home-based. You can do the 5 stairs in the clinic all day long, but if you have 12 at home, we can't really simulate that in the clinic. So being within your home is really, there's a lot of benefits to that if you're open to it. Some people aren't, and that's okay too. But, any other questions for the whole group?
We're good to go?
Yes. Thank you very much.